kapatid for today, and at this moment we'll be discussing about trigeminal neuralgia, still under kapatid sa inyong neuro concepts and still under for your medical surgical nursing for the PNLE and also adult nursing or medical nursing for your NCLEX. So I hope everyone is doing well right now. So this one is actually one of the um, most important concepts that we'll be having for neuro nursing. Okay, so let's start discussing here right now. So when we say trigeminal neuralgia, this is otherwise known as your tic doloro. Okay, it is a sensory disorder of cranial nerve number 5. Again, this is a sensory disorder of cranial nerve number 5, and we need to remember that one. Kapatid, kapag sinabi nating trigeminal neuralgia, it results from severe, recurrent, sharp facial pain along the trigeminal nerve. Okay, again, if you're forgetting your trigeminal nerve, it is a nerve. It is a cranial nerve that's responsible for your chewing. That's why whenever I teach this one, I always refer to this one as your trigeminal nerve. Okay, your trigeminal nerve because it's the nerve it's the cranial nerve responsible for your chewing. Okay, and what are the possible assessments na makikita natin no in your trigeminal neuralgia? Okay, so first is of course when you think of your neuralgia, so again whenever you see those suffixes algia, so it means kapatid, ang ibig sabihin niyan kapatid, it's pain, just like your arthralgia, it's your joint pain, or your otalgia, it's your ear pain. And now for your neuralgia, it's a pain in the nerve. Okay, so what nerve is that? It's your cranial nerve number 5 or your trigeminal neuralgia. Okay, so one of the most dominant assessments that we can have and we can find in your trigeminal neuralgia is severe pain on your lips, on your gums, on your nose, and including in your cheeks. Okay, the area around your cheeks. Okay, again, the severe pain kapatid, no? Severe talaga. Severe pain on your lips, gums, nose, and also in your cheeks. Okay, so that's trigeminal neuralgia. We have your severe pain. So what have caused no the severe pain for us to have this condition right now? So we can see that there are some causes and stimulants no why this pain, why this severe pain occurs, why this sudden um, sensation of severe pain occurs because napaka sakit talaga no na na-experience ng pasyente natin o ng kliyente natin experiencing trigeminal neuralgia. So first you think of just cold, okay? Washing the face, yung mga tao kapatid na nagwawash ng kanilang face, chewing. That's why I told you earlier that trigeminal nerve is the ones responsible for chewing and also for food, fluids, and of course, this extreme temperature. Halimbawa, nung katapos mong uh, magpainit sa mukha, no? Halimbawa, those that you experience in your facial care, okay? In the facial, sa mga spa, yun na nakaka-experience ng mainit and then nagta-transition tayo ng bigla no, sa malamig. Okay, those are extreme temperature and that can trigger our patient to have this trigeminal neuralgia. Okay, so what are the interventions that we can have? Again, you think of this pain. Ano, what type of pain? It's excruciating pain. It's actually very, very severe pain. Okay, so let's talk about the interventions that we can have here. What are the possible interventions that we do? First, you instruct the patient to avoid hot or cold foods and fluids. Okay? So, avoid also yung paggalaw ng pasyente sa kanyang muka. Okay? And avoid also those hot or cold foods or fluids. Okay? So, again, tandaan po natin yan. And also, provide small feedings. Also, avoid lang muna yung mga cold na mga soft food. Halimbawa yung mga ice cream, ganun. Okay? Bawal muna yun, kapatid. Okay? And also, instruct the client to chew food on the unaffected side. So, saan natin yung nguyain, kapatid? It's on the unaffected side. Kung nasa right side yung ating affected, you put it on the left. Kapag nasa left naman, you put it in the right. Okay? So, again, instruct the client to chew food on the unaffected side. And that's very, very basic, kapatid. Okay, also, administer medications as prescribed, kapatid. You know what? The pain that we can have um, in your trigeminal neuralgia, the cause of this one is on the nerve, no, and this can be relieved by um, also providing your patient some highly or high doses of analgesics, because what we have in the book is that you give your patient acetaminophen and that's it. Okay? Kapatid, bigyan mo ng acetaminophen si patient, and then what's the most important um, parameter that we should be reminding ourselves this time? Remember that your acetaminophen causes your liver damage. Kapag nag-overdose tayo dyan, it might cause liver damage. So always watch your liver parameters like bilirubin, all of those, no, that gives us the status of your liver function. Okay, liver function test. Okay, so again, acetaminophen you give or you prescribe. I mean, you give the prescribed acetaminophen, and also take note about having it, no, because it's hepatotoxic. Okay, so it may cause hepatotoxicity to our patient. Okay, so now, what are the surgical interventions that we can have? No, there could be various actually interventions that could be done to the patient experiencing trigeminal neuralgia. First, kapatid, yung tinatawag nating microvascular decompression. Kapatid, when we say microvascular decompression, it means that this procedure is actually a surgical relocation of the artery that compresses the trigeminal neuralgia. So baka lang naman, no? That's why we call it microvascular decompression. Kasi we will relocate now the artery that might have caused, no, the compression of the trigeminal nerve. Okay? Ganun lang yon. It's what we call as your microvascular decompression. Pangalawa is yung tinatawag nating radiofrequency waveforms. Dito naman, class, magkakaroon tayo or gagawa tayo ng lesions that provide relief of pain without compromising touch or motor function. So, ito naman, class, gagawa tayo dito ng mga lesions, no? So that marirelieve po ang pain ng pasyente natin without compromising touch or motor functions. Another, kapatid, ito, parati itong lumalabas, no, sa mga tanungan, rhizotomy. Okay, when we say rhizotomy, this is the resection of the root of the nerve to relieve pain. So again, just like in compartment syndrome, kung meron tayong tinatawag na fasciotomy, wherein we are doing a resection in the fascia, dito naman, kapatid, in your trigeminal neuralgia, gumagawa tayo ng resection, okay, on the root of the nerve, and we call that rhizotomy. Okay? To relieve pain. Okay? Another also is your glycerol injection. Kapatid, ang ginagawa natin or ang motibo natin kung bakit tayo nag-glycerol injection is that this is this procedure actually destroys the myelinated fibers of the trigeminal nerve. So, para siyang ipapatayin natin, no, or we will really destroy the fibers, no, the myelinated fibers in the trigeminal nerve, lalo na doon sa affected side. Okay, so that the problem or the decompression or the problem that we have or the patient experiencing in trigeminal neuralgia would be relieved at this time. But remember that in glycerol injection, it may take up to 3 weeks, okay, for pain to subside or to be relieved. Okay? So, that's it, kapatid, for your trigeminal neuralgia. Thank you, Taps. Maraming salamat po sa inyo. Top of the morning, top of the day. I hope and I pray that everyone's doing well. Ingat.